Hello, my name is Lindsay Franklin. I am the Executive Assistant Director of Operations for the American Board of Urology. We look forward to welcoming you to the 2023 Certifying Part 2 Oral Examination in Raleigh, North Carolina. The ABU is committed to maximizing the safety of all participants, candidates, examiners, and staff, while we fulfill our mission and board certification of the 2023 oral exam. As you are aware, the ABU is implementing the following mandatory COVID-19 safety protocol. All participants will need to provide either the COVID-19 vaccine record card from the CDC or proof of immunization from a healthcare provider. A signed attestation to the authenticity of the provided COVID-19 vaccination record is required. Medical exemptions documented by a medical provider will be considered. All documentation must be uploaded to the ABU candidate portal. All participants will attest to being COVID-19 symptom-free at registration the night before exam. All participants must acknowledge that ABU cannot guarantee that you will not be exposed to or contact a communicable disease at the exam. All participants must notify ABU if they become symptomatic while in Raleigh. All participants must notify ABU if they become symptomatic and test positive for COVID-19 within 10 days after their participation in the certifying exam. This information will be shared with other participants for the purpose of contact tracing, but the identity of the affected participant will be kept confidential. All participants must sign an acknowledgement of this policy. Masks are optional. The 2023 oral examinations will be administered on Friday, February 24th, and Saturday, February 25th. You have been assigned one exam date and will participate in 2 conjoined exam sessions. Exam dates were distributed by email on December 7th. You will complete your exam in 1 session, consisting of 2 50-minute exams. You will have a 10-minute break in between exam sessions, at which point you will switch examiners. You will be tested on 4 clinical scenarios and 2 objective structured clinical exams, OSCEs. Each period will include 2 10-question protocols and 1 5-question OSCE in the same exam room. You will be permitted 20 minutes per 10-question protocol and 10 minutes per 5-question OSCE. OSCE assessments may include the presence of an external participant, an actor, with whom you will need to interact during the OSCE. You will have 2 examiners for each exam session. Each room will have a lead examiner administering the first protocol for the exam and a co-examiner who will be observing. The roles will reverse for the second protocol. Both examiners will score for each candidate. If you have a Friday exam, you must register in person in the Grand Ballroom at the Hilton Raleigh North Hills between 5 and 6 p.m. Eastern Time on Thursday, February 23rd. If you have a Saturday exam, you must register in person in the Salon Ballroom at the Hilton Raleigh North Hills between 5 and 6 p.m. Eastern Time on Friday, February 24th. At registration, you will receive an ABU ID badge, which is required for admission to the exam. The badge will bear your photo and a candidate ID number. On the back of your badge will be a label bearing your name as you indicated on your Part 2 application. This is how your name will appear on your certificate when you complete the certification process. If you would like your name to appear differently or need to change something, please let one of the ABU staff know at registration. The ABU staff, guides, monitors, and security personnel will be verifying your identity throughout the 2 days of your exam. So please be sure to wear your ID badge around your neck whenever you need to report for exams and during any sequestering period. At the start of each exam session, your examiner will ask that you read aloud your ABU ID. Your ABU ID is located on your badge. On the day of your exam, if you have a morning session, a 7 a.m. or a 9:50 a.m. start time, you will report to the Grand Ballroom at the Hilton 30 minutes prior to your exam start time. For afternoon sessions, 1 p.m. candidates will report to the Grand Ballroom at the Hilton at 12 p.m. and 3:50 p.m. candidates will report at 12:30 p.m. A box lunch will be provided at check-in. The badge you will receive at registration will include your report time, your exam time, and reporting location. All candidates will be escorted to their oral exam encounters by a guide from the ABU staff. Shortly before your exam period, guides will enter the ballroom and announce a list of candidate numbers. Please listen carefully for your ABU number. Each guide will be taking a group by shuttle to the AIM Center just a few minutes away. When you hear your number called, please assemble with your guide, who will then escort your group to the shuttle and to the AIM Testing Center. Immediately following your first exam session, you will exit the exam room and report to a holding room where you will check in with a monitor. Here you will have a 10 to 20-minute break to use the restroom, grab a cup of coffee, or simply decompress. At the start of your next exam, a guide will escort you to your second exam period. At the conclusion of your second exam period, you will once again report to a holding room. Once your group has reassembled, your guide will escort you back to the Hilton. Morning exam candidates will be sequestered at the Hilton until approximately 12:30 p.m. and then released. A box lunch will be provided upon your return to the Hilton. Following each afternoon session, candidates will be escorted back to the Hilton and free to leave. During your exam, your examiners will provide you with a paper case summary for each protocol and OSCE. The summary will include details relevant to the case scenario. You are permitted to write on the case summaries. Paper and pencils will be available for your use in the examination rooms. You may take notes during your exam or make calculations on that paper, and you must leave it with your examiner at the conclusion of your exam. You may not bring your own writing implement. In addition to the case summary, your examiner may share images relevant to the protocol or OSCE. Please recall signing a confidentiality statement with your online application. Additionally, you have authorized the ABU to record the video and audio of your exam sessions. These recordings are for internal purposes only and will be retained in accordance with ABU retention policies. The board has established rules regarding appropriate behavior during examinations so that they are administered in a fair and impartial fashion. You may not bring personal items, papers, notes, or study materials of any kind with you to your sequestering or examination times. Absolutely no electronic devices are permitted. You may not wear a watch into the sequestering room or exam room. All briefcases, luggage, etc. must be left in your room or checked with the bellman of the hotel when you report prior to your exam. Please do not be noisy or disruptive in the exam areas. Do not cause distractions. Please do not discuss any of the content of the exam with anyone during your oral examination. Please do not share information about the exam content following the exam. You may not retain any notes taken during your oral examination. You may not remove exam materials from the exam rooms. Please do not discuss or disclose the content of the examination to others or reproduce any portion of the examination in any manner, including the reconstruction through memorization or dictation. Your cooperation in refraining from all conversation about the examination in between sessions will help maintain a proper testing environment. Recording, transmitting, or transcribing any portion of the examination will result in invalidation of your exam, forfeiture of your registration fee, and permanent ineligibility for ABU certification. In addition, the ABU reserves the right to prosecute those responsible under all applicable state and federal laws, including but not limited to copyright laws. We have secured a luggage hold near the grand ballroom for those checking out and departing after their exam session. If you have any problem or situation arise during the exam, please talk to ABU staff. If we can assist you, we will make every effort to do so. Results will be posted to the candidate and diplomate portal approximately 3 to 4 weeks following the exam. We will notify you by email when results are posted. On behalf of the ABU staff, we wish you a successful examination experience. We know what you have invested in your training and in this certification process. And if we may be of any assistance at any point, please let us know. I would now like to introduce the Oral Examinations Chairman and ABU President, Dr. Gary Lemack.
Hello and welcome to Raleigh and the certifying examination from the American Board of Urology. I'm Gary Lemack, current president of the ABU and chair of the certifying examination committee. We know it's been a real long journey to get here, medical school, residency, and then in your practice now for the last year or more. And we're very proud, as you should be, of the many accomplishments you've already made. Our job during this process is to allow you to showcase your knowledge and your communication skills At the same time, we have a job to do in the ABU, and that is we recognize that having a certificate from the board is an honor, should be an honor, and we are committed to protecting the public as part of that, our responsibilities. So we do take very seriously maintaining the integrity of the examination process of both the qualifying and the certifying examinations, and they're really critical in how we assess our candidates. We ask you not to discuss or share the exam content outside of your examination, and we ask you to avoid any what we would call irregular behavior. Any action by the applicant or potential applicant that attempts to subvert the process of certifying examination is something we take really seriously. So falsifying information, giving or receiving unauthorized assistance, altering or misrepresenting scores, unauthorized reproduction, or posting or discussing particular content online or asking others to comment on that is really something we take seriously and we ask you to avoid. Recall, we have this examination just once a year for all the urologists in the country, and so it's really critical that we maintain the integrity of the process. If we are made aware of any irregular behavior of the examination process, then the board does reserve the right to look into this, and any action may include warning or censure, deferral from the certification process, or suspension, or even revoking a certificate after it's been received. So please, we take this very seriously. Remember, the objective of the exam is your ability for us to be able to assess your ability to collect and integrate information. We're going to ask you to solve problems. We're going to, in specific instances, may ask you knowledge of specific surgical procedures or techniques. Preoperative and postoperative decision-making is quite critical. Managing complications, the ability to communicate with patients and families is something we take very seriously, and the ability to practice in an ethical and safe fashion. It is an interactive process, as you know. You will be tested on 4 clinical scenarios or protocols, 2 for each session, and 2 OSCEs, overall 1 for each session, as you know. Protocols represent a wide spectrum of urological practice. As you're well aware, one of these OSCEs will focus on a diagnostic study used in practice, and we'll ask you to be involved in that diagnostic study and ask yourself questions regarding that. And one OSCE will involve an actor with whom you will directly interact, and the examiners will be observing that interaction. You will be provided with 1 case summary of the chief complaint, history of present illness, review of systems, and any other pertinent information that you will need to start that protocol. You can write on these sheets, feel free to, but they must stay in the room after you're done. This information will provide you the essence of the history and physical findings, but it's not that you will not require other perhaps studies or other parts of the evaluation during the protocol. So it is a starting point, and you should be able to start that protocol with that information. All examiners will follow the same script for the protocol, so you will receive the exact same protocol as everyone else who's taking the exam at the same time. The examiner should make it obvious to you whether or not he or she is trying to get other information from you or has provided you with relevant data and you need additional data. But don't assume that any routine tests that have been in the case summary have been done if they aren't provided with you. So if it's not shown there in the case summary, then feel free to ask for it or ask for additional information that you think is necessary to make a decision. Don't guess. If you're not familiar with an area, then tell the examiner that you're not familiar with that area and move on. Don't get bogged down. Your answers really should be brief and concise so that you have plenty of time to express your understanding of the protocol and to show your mastery of that particular area. You may be asked in certain instances if you want to expand your choice. If you've given 1 or 2 choices and the examiner is asking for additional elements of that, then they will make that clear to you and do your best to come up with other areas. At some point, the examiner will move on to the next protocol or the next question. Again, if the examiner cuts you off, it typically means that you've already assessed your knowledge in that area, and we want you to move on to the next question so you can get through the protocol succinctly. If a situation is unfamiliar to you and you don't do it daily in your practice, we understand that. You can't necessarily do all aspects of urology in your individual practice, but we do anticipate that you've learned that and studied that. So try to work out the problem, but do move along. The examiner really is sort of interested in how you would solve a problem, what information you're looking for. If you feel as though you've answered a question incorrectly, again, move on. It's only 1 question in that protocol, and it's only 1 small part of it. So don't get bogged down or concerned about it. Just move on to the next question in that protocol. So what are we evaluating? We're really evaluating if, if it's, you can determine if appropriate history and physical information is available or other information available. Did you order appropriate tests? Do you have sufficient confidence to avoid unnecessary tests or needlessly invasive tests? That's critical too. And whether you're able to organize information, synthesize it, interpret laboratory and diagnostic studies appropriately. What are we evaluating? In addition, we were evaluating if you have a good understanding of the disease process and have safe clinical management and how you handle complications, provide a strategy for follow-up care, but also your ability to communicate effectively. And all these parts of your interactions are really important. So again, when you're asked to evaluate, you're asked to interact with the examiner and in a particular protocol and maybe interact with a patient in the process of that protocol, you should act as if you're interacting with that patient, showing the type of how you would specifically talk to the patient and how you would go about further evaluating, and if a complication comes up, how you would go about treating that or going through that and how you would discuss that. As you're aware, there is very specific scoring rubric. The examiner will evaluate performance on specific questions. I mentioned each question within the protocol will have a score of 1 to 5. Typically, we'll actually have 10 sections in the protocol. And the sections of that protocol may have different areas that we're looking at, whether it's a differential diagnosis, management, complications, follow-up. And then there's an overall assessment score that we use as well. That does count more than each individual question, roughly about a third to a quarter of that particular protocol. So it's important that our examiners get a feel for how you're getting through each protocol, and that's weighed a little more heavily in the overall assessment. And if you're worried about it, the scoring is adjusted for each examiner's grading severity. So I know people sometimes feel like they have an examiner that's tougher or may score tougher. We do look at that very specifically and do adjust the scoring appropriately if that's the case. Our examiners are very thoroughly instructed to allow you to demonstrate your knowledge, evaluate you objectively on each question with a very specific rubric to be fair, consistent, and courteous and assess your performance. If there's any concerns that you might have during your test, that there's been a breach of this or concerns about this, then I'd ask you to reach out to me or Dr. Thrasher or anybody in the ABU staff about this and your specific concerns. There is a time and availability to write down any concerns you have on a survey afterwards about specific protocols and ask you for comments about your examiners as well. But if there's not something you're very concerned about while at the exam, I would ask you to reach out to me, get through the ABU staff. They can contact me if you have any specific concerns. With regard to the results, I've showed this before, but 97% of people did pass the exam last year. 93% of repeated candidates passed the exam, which was a small fraction, and 97% of first-time examinees passed the exam. So we go with this. With the model that I've described in the past, there's not a specific cut point. It depends on how people do. Last year, people did quite well through all the protocols, and we had a higher pass rate, which was great. We want you to, if you can, after this, I know it's been a lot to go through, and it's certainly a big stressor for you. And when you're done, I think the last thing you want to do, perhaps, is provide feedback. But it does help us. It's allowed us to make many changes over the last couple of years that you've seen and I've discussed before, that hopefully has improved the process and also your ability to get tested fairly and get back to your practices quickly. So we will send a questionnaire to you, and we appreciate if you could send us back comments about the exam and the process. We are continuing to try to improve it. We believe that candidates obviously deserve a fair and uniform examination experience. I think we've made a lot of headway in that regard, but we still will critically look at it, of course. We know this process is stressful. You perform your best. You are involved in stressful situations all the time as a surgeon, but please take a deep breath, relax, demonstrate your breadth of knowledge to your examiners. You've made it this far because you know quite a bit. You have the knowledge, urologic knowledge, and has been tested. And so we know we have it in you. It's a little bit of a scenario in terms of what we're examining here, but we certainly want you to be able to express that, and that's our job. With that, I thank you very much for your time, and I wish you the very best on this examination. And please do reach out with any questions or concerns. Thank you.